A very important question, doctor. Median nerve injury above the elbow. What are the muscles that it supplies and what is the loss of their function lead to? Median nerve injury above the wrist. If there is an injury, what are the muscles affected and what are the functions of those muscles which are affected? Favorite question of the examiner. I am going to make you Mahagyani in this very, very important topic. Let's talk about the anatomy of the median nerve. Median nerve कहाँ से आता है? C5, C6, C7, C8, T1. The entire are the roots of the median nerve. Median nerve होता है mixed nerve. It has both motor and also sensory supply. Median nerve को median बोल के क्यों कहते हैं? Because it passes to the median plane of the forearm. Right? So that is called median nerve. So typically it arises both from lateral cord and also the medial cord. You know very well brachial plexus has got lateral cord, medial cord, posterior cord, etc. Right? So both lateral cord and medial cord give rise to median nerve. Then it runs along the lateral aspect of the axillary artery. So let us see that. You can see that this is the axillary artery. And what is this very thick nerve that you are seeing? It is the median nerve. And what is this nerve which is passing on the side of it? That is the radial nerve. So the median nerve will be passing along the lateral aspect of the axillary artery is what you have to very, very clearly remember. Now it runs lateral to the brachial artery from the axillary artery. Continuation क्या होता है? Brachial artery. And it crosses the brachial artery anteriorly and it passes anterior to the elbow joint. You have to parallelly keep imagining the passage of the median nerve along your own body. Then you will remember it easily. Now the median nerve runs down the arm and it passes on the medial side of the arm between the brachialis and the biceps brachii. Brachialis and biceps brachii, between the two passes the median nerve is what you have to remember. Now if you look at the branches of the median nerve above the level of the elbow joint, you should remember that there is a lateral cord, medial cord which is contributing to the formation of the median nerve. That you will remember, right? So from the median nerve comes the branch to the palmaris longus, Pronator teres, flexor digitorum superficialis, flexor carpi radialis. So these are the four muscles to which it will be giving the branches, the median nerve. Once more, revise Dr. और एक बार, Pronator teres, median nerve. Supinator is by radial nerve. Pronator teres is by median nerve. That's what you need to remember. Then Pronator teres, if you do pronation, क्या हो जाता? Your palm is moved into a position that you can press. So you can remember palmaris longus also is by the median nerve. Then flexor digitorum superficialis and flexor carpi radialis. They are the four muscles you are not going to forget, which are supplied by the median nerve above the level of the elbow, That is very, very important. So there is an entity called Pronator syndrome. What is the meaning of Pronator syndrome? Typically, the pronator can get entrapped whenever it is passing through this Pronator teres, right? It supplies a branch to that and then passes in the middle of that muscle, between two muscles when it is passing. If you try to pronate against the resistance, if you give a handshake to somebody and try to pronate him against the resistance, then the median nerve get injured and that lead to pronator syndrome, and that lead to hyperesthesia of activity, or it will lead to hyperesthesia or activity induced paresthesia. They can happen because the median nerve is one which is pressed by the overlying pronator muscle. Lot of times examiner ask a question, somebody against resistance pronation किया गया, उसके बाद उसको hypoesthesia आ गया, which is the nerve possibly involved? You should immediately say it is the median nerve which is involved in the pronator syndrome is what you should remember. So here you can see whenever the median nerve is passing through the elbow, it is passing deep to two important structures. There is one bony spur on the humerus which is called supracondylar spur, and this ligament is there, no doctor, this is called Stuther's ligament. So between the bony spur and the pronator teres muscle का ligament को क्या बोलते हैं? Stuther's ligament. Between the two, this is the spur of the bone and this is the Stuther's ligament. Through that is passing the median nerve, and then it is passing between the pronator teres, and then it is coming out. So that is the reason this is a very risky area where the median nerve can get compressed, can become injured. So examiner will ask you a question, Stuther's ligament is associated with which nerve? आप क्या बोलेगा exam में? Median nerve. Stuther's ligament is associated with which muscle? It is typically very closely related to pronator teres is what you have to basically remember. So the median nerve passes between the two heads of pronator teres. It runs deep to the fibrous arch of the flexor digitorum superficialis in the proximal 1/3, and in the mid forearm it descends between two muscles. What are the two muscles between which the median nerve is passing? Between flexor digitorum superficialis and flexor digitorum profundus. Between the two, the median nerve is passing. Typically when it is descending down the forearm is what you need to remember. And about 5 centimeters above the wrist, typically it will be passing along the lateral side of the flexor digitorum superficialis and become superficial just above the wrist. वो बाहर कब निकलेगा? The median nerve only when it enters into the wrist at the point of wrist, that becomes superficial is what you need to remember. So if you look at the median nerve passes in the forearm anterior to the elbow joint. बराबर है? Between the two heads of the pronator teres. बराबर है? It innervates most of the muscles in the anterior compartment of the forearm. Most of the muscles. Pronator teres is supplied by median only. Palmaris longus is also supplied by the median nerve only. Flexor digitorum superficialis is also supplied by the median nerve only. Then what are those muscles in the flexor compartment of the forearm? Anteriorly आप जो देख रहे हैं ना, that is flexor compartment, which is not supplied by the median nerve is very important question. Flexor carpi ulnaris is not supplied by median nerve. Then flexor digitorum profundus medial half is supplied by ulnar nerve. Ulnar nerve, not by the median nerve. So that is what you have to remember. So most of the muscles in the anterior compartment or a flexor compartment of the forearm is ruled by only two nerves. What are they? The median nerve, ulnar nerve. So all the muscles in the flexor compartment are supplied by the median nerve except two muscles. What are those two muscles? Flexor carpi ulnaris and medial half of the flexor digitorum profundus. These are the two muscles which are supplied by the ulnar nerve but not by the median nerve is what you have to basically remember. Now let us look into it. You can see that the median nerve is divided into the anterior interosseous nerve, and it is also supplying the flexor digitorum superficialis, and this is the typical anatomy in the forearm of the median nerve. Now, if you look at the median nerve injuries, they can be divided broadly into injuries in the elbow region, injuries just above the wrist, typically above the flexor retinaculum, and whenever it is passing through the carpal tunnel, whenever it is passing, there also median nerve can get injured. So now, if you look at the median nerve and its branches, what is the main branch of the median nerve, doctor? Anterior interosseous nerve is the branch of the median nerve. Anterior interosseous nerve, which is the branch of the median nerve. If anterior interosseous nerve, can you give me the board please? If the anterior interosseous nerve is the branch of the median nerve, commonly asked question, two interosseous nerve आप याद रखना. Forearm में two interosseous nerves होता है. One is anterior interosseous nerve, other is posterior interosseous nerve. पिन आइन, आइन कहां से आता है? Anterior interosseous nerve is the branch of the median nerve. Posterior interosseous nerve is the branch of the radial nerve, is what you need to remember. Now, this median nerve branch जो anterior interosseous nerve है, this supplies typically three very important muscles in the forearm. What are those? Directly supplied by anterior interosseous nerve. Number one, pronator quadratus is supplied by anterior interosseous nerve. Then flexor digitorum profundus, medial half is supplied by ulnar nerve. You will not forget it, right? You will promise me that you will not forget it. Flexor digitorum profundus, medial half is by ulnar nerve. You are not going to forget. Whereas lateral half of the flexor digitorum profundus is supplied by the median nerve, is what you need to remember. Which branch of the median nerve? Anterior interosseous nerve, which is the branch of the median nerve, supplies the lateral half of the flexor digitorum profundus, is what you are going to remember. Then pollex. एक जमाने में एकलव्य ने गुरु दक्षिणा के लिए क्या दिया? अपना थंब दे दिया, है ना? मॉडर्न टाइम में गुरु दक्षिणा के लिए आप यू मेडिको का सब्सक्रिप्शन, पेड सब्सक्रिप्शन लेना पड़ रहा है, राइट? नो वरीज, आई डोंट वांट योर थंब, बट डोंट फॉरगेट to give a call to our helpline number and then subscribe. Paid subscription ले लो on umedico and anatomytomedicine.com, and your subscription means a lot for us, right? Now, thumb जो होता है, इसको सप्लाई करने वाले flexor pollicis longus. If you want to flex, thumbs up, you say no. So this is thumbs down actually. So flexor pollicis longus and lateral half of the flexor digitorum profundus and the pronator quadratus, they are the muscles which are supplied by anterior interosseous nerve, which is the branch of the median nerve, is what you have to ultimately remember, doctor. Yes? Now, typically, whenever the median nerve is entering into the palm, then what is it supplying? जब आप palm देखते हैं, इसमें थंब के साइड में होने वाला क्या बोलते हैं? थीनार. लिटिल फिंगर की तरफ होने वाले चीज को क्या बोलते हैं? हाइपोथीनार बोलते हैं. The thenar group of muscles are all supplied by the median nerve. So, what are those thenar muscles that you are going to remember? which are supplied by the median nerve in the palm. Give me the board. Is what we should remember very clearly. और एक बार बोल रहा हूँ डॉक्टर, radial nerve, median nerve, ulnar nerve, axillary nerve, musculocutaneous nerve. ये पंचभूत है, right? One question in NEET PG without one of these nerves नहीं होता है, and you have to be very, very, very sure about them, right? Now, अभी चर्चा करेंगे. मीडियन नर्व पहुंच गया, कहां पहुंच गया? मीडियन नर्व reached the palm. So what are those thinner group of muscles which are supplied by the median nerve is my question to all of you. Abductor pollicis brevis is by median nerve. आपके एकलव्य का फिंगर है ना, हम इसको अगर आप एब्डक्ट करना चाहिए तो एब्डक्टर पॉलिसिस ब्रेविस, अपोनेंस पॉलिसिस. अपोनेंस बोले तो ओम नमः शिवाय बोल के आप लिटिल फिंगर एंड थंब को दोनों को एक जगह पे लाए तो आपका थंब क्या कर रहे हैं? अपोनेंस रिएक्शन हो रहा है. सो दैट इज opponens pollicis is also supplied by the median nerve. Then flexor pollicis brevis is also supplied by median nerve. So median nerve supplies abductor pollicis brevis, opponens pollicis, flexor pollicis brevis. All the three are supplied by the median nerve is what you need to ultimately remember. So doctor, in quick summary, you should know what muscles are supplied at the level of the elbow, at the level of the wrist, at the level of the palm by the median nerve. Now you are very, very clear. So ultimately, the median nerve also supplies lumbricals. The first, that is thumb, and the second is the index finger. ये दोनों का lumbricals muscles जो होता है, they are supplied by the median nerve. What is the function of lumbricals? Whether first हो, second हो, third or fourth or fifth finger, lumbricals का एक ही काम होता है. What is the function of lumbricals? Is very, very, very important. To remember the function of lumbricals, very simple. You hold your, like a Nagaraj, like a serpent, you hold your palm like this. ऐसे करे तो क्या हो रहा है? There is an extension of your interphalangeal joints and there is a flexion of metacarpophalangeal joint. Right? If you do in a L shape, then these are all proximal, middle, distal, interphalangeal joint. So they are all interphalangeal joints. Extension of interphalangeal joints. And what is this? Here you have your knuckle, right? ऐसे लगाए तो knuckle है ना, यहाँ, right? So this is metacarpophalangeal joint. Flexion of metacarpophalangeal joint, extension of the interphalangeal joint. That is the function of the lumbricals. L shape होता है ना, इसको reverse करो, ऐसा करो. L को reverse करो, right? So that is the function of lumbricals. So which lumbricals are supplied by the median nerve? The first and second lumbricals are supplied by the median nerve is what you have to basically remember. So doctor, let us start once more. ये ऐसे टॉपिक हैं बार बार हम चर्चा करना. Give me the board. I am once more summarizing what all that I told you. C5, C6, C7, C8, T1, टक ऐसा आ गया. आप भी ये सेशन होने के बाद आपके रूममेट के साथ बैठ के एक व्हाइट पेपर लेना, पेन लेना, बैठना, उसको पढ़ाई देना. Then only you understood the concept, and without shaking, tomorrow you will answer in the exam hall. Now, typically this is at the highest level, root level. Uske baad it is coming down the median nerve up to the elbow joint. It did not give any branches. Typically at the level of the elbow joint, it gives the branches to the elbow joint. Then directly median nerve gives branches to whom? Pronator teres. Once more I am repeating for all of you, doc. Pronator teres. Then flexor carpi radialis, palmaris longus, and flexor digitorum superficialis. These are all supplied by the median nerve directly. Then what else it will do? It will be giving rise in the forearm to anterior interosseous nerve. So what are the supplied by anterior interosseous nerve? Flexor pollicis longus. Then lateral half of flexor digitorum profundus is supplied by flexor digitorum profundus is also supplied by the median nerve. Then you are having pronator quadratus. Pronator quadratus is also supplied by the median nerve, is what you need to remember. Then wrist joint aa gaya. I mean, these are all supplied by whom? Anterior interosseous nerve, which is the branch of the median nerve, is supplying these three. Then after that kya ho gaya? Oh, it has come into the palm. So once it came to the palm, it is supplying the first and second lumbrical, and there are three thenar muscles. Three thenar muscles it is supplying, and it is giving the sensory supply to the lateral 3.5 fingers. Palmar aspect of lateral 3.5 fingers. Always fingers may medial is little finger, lateral is thumb. So thumb, index, ring, and half of the ring, thumb, index, middle, and half of the ring finger, right? So these are the ones which are basically innervated. That part of the palmar surface is innervated by the median nerve, is what you have to ultimately remember. So doc, give me the board. So whenever there is a high median nerve injury, there is an injury which is proximal to the elbow, then why can it happen? So typically it can happen proximal to elbow whenever there is any forearm fractures, or if there is elbow dislocation, if there is any stab injury, then there will be paralysis of all the muscles which are supplied by the median nerve in the forearm and also in the hand. Everything get affected. Whereas low median nerve injuries, that is injuries which are distal to the, distal to the distal third of the forearm, right? So injuries in the distal third of the forearm, that is called low median injuries. So distal third of the forearm, forearm, right? After elbow you call forearm, right? Above the wrist. Don't be angry on me. After all, I come from Telugu medium. In my schooling, always in anatomy, I never know what is arm and forearm until my classmates told, hey, Mandamati, tu dekho, arm hota hai ye, forearm hota hai after elbow. So doctor, at what stage of ignorance we are doesn't matter. Suppose your recent NEET PG exam if you are not even qualified, there is nothing to cry about it, bleed about it. फिर हम बैठेंगे, पढ़ेंगे, MCQs करेंगे, videos review करेंगे, notes को bookmark करेंगे and every day we become strong, automatically you will do miracles. You will be in the top 300 ranks. That should be the only dream, right? So, typically the muscles of the hand get paralyzed and there will be anesthesia along the lateral 3.5 fingers is what you need to remember. And because thenar 3 muscles are affected, the thenar eminence become atrophied and the abduction and opposition of the thumb become weak is what you have to basically remember. So how do you test the median nerve injury and the muscle supplied by the median nerve is a very, very important question. Flexor pollicis longus supplied by the median nerve. Basically, it is tested by holding the thumb in the base and the patient is asked to flex the terminal phalanx. Can he do that? That is how you are testing flexor pollicis longus. Then flexor digitorum superficialis and the flexor digitorum profundus. The lateral half of the flexor digitorum profundus is supplied by the median nerve, no? So how do you test that? Very simple. Ask the patient to clasp the hand. I am going to win the NEET PG. करके दिखाओ, बोलना उनको. Suppose while doing that, if the index finger to clasp, all your fingers must come and flex, right? If the index finger is not able to flex and pointing, then that is called median nerve injury, which is called Oshner's sign positivity is what you have to basically remember. Then flexor carpi radialis, if it is affected in median nerve injury, the hand become deviated towards the ulnar side whenever you are trying to flex against resistance is what you have to remember. Then you look at the thenar eminence of the person. The 3 thenar muscles are affected, no? One of them is abductor pollicis brevis. How do you test that? Abductor pollicis brevis is tested by doing the pen test. Pen test bole to, ask the guy to put his palm flat on the table and you hold the pen and say, please touch the pen. He cannot. Because for that you require the abduction of the thumb should happen, which cannot happen if the abductor pollicis brevis, which is supplied by the median nerve, is paralyzed is what you have to remember. Then opponent's pollicis, how do you test? You ask the person to bring the tip of the thumb towards the tip of the other fingers. Sa, ri, ga, ma, pa, da, ni, sa करने के लिए बोलो. नहीं कर सकता. He cannot touch the tip of the other fingers with the tip of his thumb. That is the test of the opponent's pollicis. So, these are the few issues. Then, you have a sign of benediction, which is positive, just like the Pope, sign of benediction. So, that is another important thing. Once more, what are you testing in the sign of benediction? You are trying to cause the flexion of the phalanges. Flexion nahi ho raha hai because the phalangeal flexion requires the forearm muscles which are supplied by the median nerve. The median nerve you have seen, no? Entire flexor compartment. Kiska raja kaun hota hai? Median nerve hota hai. All forearm flexor muscles are supplied by the median nerve is what you have to basically remember. Then you have OK sign. In OK sign, what are you testing? OK sign. So, you are once more checking for the opponent's function. So, it is also called clean neos. OK sign is what you need to remember. Then A thumb deformity. Typically, the abductor pollicis is affected in median nerve injury. That is the reason the thumb remains closely adducted. It is unable to abduct. Then it is in extension because unable to flex. And the thenar muscles are all paralyzed. So, the combination of loss of abduction leading to tight adduction by the thumb and the extension of the phalangeal joint of the thumb along with atrophy of the thenar muscles. The combination is called ape thumb deformity is what you need to remember. Now, benediction sign, which we have said. Why the sign of benediction occur? What is the sign of benediction? Is very, very important to understand. So fundamentally, the inability to flex the thumb, inability to flex the index will make them to stand in prominence. Whereas the middle finger, actually the thumb, index, middle, all the three अगर inability to flex and extension में है तो इसको बोलते हैं the Pope's benediction, right? But sometimes the middle finger's flexion is controlled by the ulnar nerve. That's the reason even if median nerve is injured, the middle finger may still be going into flexion, and only the two fingers which cannot be flexed and stand in only extension are the thumb and the index finger. These are the two fingers which are typically in extension, and that is the underlying basis. So if the examiner asks you a question, benediction sign is positive in which condition? Median nerve injury. Why it is like that? What it is? First of all, what it is? It is the extension, inability to do flexion, whereas the remaining three fingers you can do flexion, but the thumb and the index you cannot do flexion of the interphalangeal joint, because the flexor digitorum profundus lateral half is responsible for the flexion of the thumb and the index finger, and that is supplied by the median nerve. If the median nerve is injured, lateral half of the flexor digitorum profundus is weak, and that prevents the flexion of the interphalangeal joints of the thumb and the index, and that leads to the sign of benediction is what you have to basically remember. Then ape thumb deformity, that is all because of the wasting of the thenar eminence and inability to oppose or flex the thumb is responsible for the ape thumb deformity. So let us quickly summarize. Above the elbow, above the wrist, what is the differences in the median nerve injury is a very, very important question of the examiner. Loss of pronation कहाँ होता है? Above the elbow. Above the elbow. Above the wrist में, above the wrist means last 1/3 of the forearm. अगर उस level पे injury हुए तो already pronator is supplied. Median nerve already supplied pronator much higher at the level of the elbow itself. So that is the reason if the injury occur in the lateral, the last 1/3 of the forearm, then the pronation is not affected. So no loss of pronation. Then weak flexion is a feature whenever above elbow. Ulnar deviation if it is above elbow. Inability to flex the thumb, inability to oppose fingers, inability to flex middle digits, inability to flex index and middle, all are the features of the above elbow. But above wrist, there is an inability to oppose the fingers, that is there, but no inability to flex the thumb, because flexion of the thumb is with the flexor pollicis, which is supplied above the level of the wrist, not below the level of the wrist. Similarly, to flex the middle digit, to flex the index, to flex the middle finger, उसका inability नहीं होता है at the level of the wrist is what you have to fundamentally appreciate.